In this video, we are going to be looking at the topic speech therapy post head and neck cancer. Hi everyone, I'm Sharon. I'm working as an associate professor at Triple M College of Nursing. The following are the objectives that we'll be addressing in this video. Head and neck cancers are common worldwide. Surgery is often life-saving, but may cause problems with speech, voice, and swallowing. Speech therapy and nursing care are hence essential for rehabilitation. Therefore, the goal is to improve communication, confidence, and quality of life. Let's look at the impact of surgery on communication. Surgical removal may involve partial or total laryngectomy, which can lead to loss of voice. Oral cavity resections can lead to articulation issues. Tongue resection can cause reduced clarity of speech. Jaw surgery can result in difficulty with resonance and movement. The psychological impact is the loss of confidence, social withdrawal, and depression. Let's look at the goals of speech therapy. The first is to regain functional communication. Then, to teach alternative speech methods if the natural voice is lost. Ensure safe swallowing and airway protection. The next is to improve social participation and self-esteem, and to train the family and caregivers for continued support. Let's look at the techniques or voice rehabilitation methods. The first one is esophageal speech. Here we see the air is swallowed into the esophagus and when expelled to produce sound. The electrolarynx is an handheld vibrating device that is placed on the neck and cheek, and the vibration will produce a sound. The transesophageal puncture, TEP, is a one-way valve prosthesis that allows airflow from the trachea to the esophagus to produce the voice. Now, let's look at the first technique or voice rehabilitation method, which is esophageal speech. Here, the sound is produced by insufflation of air into the esophagus, essentially by swallowing air. This air is then released in a controlled manner back through the esophagus, allowing the mucosa of the upper esophagus or neopharynx to vibrate. Using these vibrations of the pharyngeal or esophageal mucosa as a sound source, the vibratory air column is channeled through the articulatory apparatus of the upper pharynx and oral cavity, where it can be modified and modulated to produce an understandable voice. The electrolarynx. It is an electronic battery-powered device used to replicate speech for laryngectomy patients by transmitting vibrations applied externally or intraorally, allowing users to articulate words through movement of the oral cavity and pharynx.
Hello, my name is Torem, and I have a voice. Hello. My name is Torem, and I have a voice. Hello, my name is Torem, and I have a voice.
In the previous slide, we were able to appreciate how a person named Tora was able to use the various voice rehabilitation methods or techniques to produce voice. Now moving over to speech and articulation therapy, the patients can be taught exercises for tongues, lips, and jaw mobility, strategies for slowing speech and over-articulation, and use of compensatory techniques such as gestures, writing, or communication boards can also be encouraged. Let's look at swallowing rehabilitation. First, let's look at the posture techniques. The first one is chin tuck. Here, the patient tucks the chin towards the chest while swallowing. This helps narrow the airway entrance and reduces the risk of aspiration, especially with liquids. The next is the head turn technique. Here, the patient turns head towards a weaker or affected side and directs the foot to the stronger side of the pharynx. This helps in improving bolus control and clearance. Now, let's look at the swallowing maneuvers to protect the airway. The first one is supraglottic swallow. Here, the patient takes a deep breath, holds it, swallows, and coughs. This helps closing the vocal cords before swallowing. Next one is supraglottic swallow. This is similar to the supraglottic swallow with an added effort. Provides greater airway protection. The next one is effortful swallow. Here the patient swallows with extra force. This improves the tongue-based movement and pharyngeal clearance. The following are the diet modifications that is advised. Thicken liquids. Liquids are thickened to reduce the speed of flow, allowing better control and safer swallowing. Soft and pureed foods are also encouraged as they are easier to chew and swallow, thereby reducing fatigue and choking risk. Gradual progression is advised. How? By advancing the diet based on swallowing assessment and tolerance. This helps in preventing aspiration as well as malnutrition. Let's look at the role of the nurse in the preoperative period. The nurse has to provide education about expected changes in speech and swallowing, offer psychological support to reduce anxiety, involve family members in counseling sessions, and prepare patient for possible use of tracheostomy as well as the alternative speech methods. Let's look at the role of the nurse in the postoperative period. With regard to airway care, to maintain and take care of a tracheostomy, perform suctioning, and ensure the air that is delivered is humidified. With regard to nutrition support, assistance with enteral feeding can be given, family members can be taught, and gradual reintroduction of oral diet can be done. With regard to communication assistance, the nurse has to teach the patient to use writing, gestures, or boards until the speech therapy begins. With regard to reinforcement of therapy, encourage regular practice of speech and swallowing exercises that is taught by the speech therapist. And also teach as well as monitor for complications such as aspiration, infection, or processes-related issues. The preventive aspects with regard to complications also have to be explained by the nurse to the patient to avoid the said complications. In conclusion, we saw that head and neck cancer surgery affects speech, voice, and swallowing. Speech therapy restores communication and function. And nurses, they play a vital role in physical, emotional, and social recovery. Combined efforts lead to improved communication, enhanced self-esteem, better quality of life, and reintegration into the society by these patients. The following are the references. Thank you.